We just
We're on.
cleared, so I don't know what to do.
Morning, folks.
Morning.
It is the 30th day of July, 2026. It's 10 a.m. We are in the Commissioner's Courtroom located at 308 North Live Oak, Rockport, Texas, 78382 at the County Courthouse. And I call this workshop to order. Roll call, please.
Commissioner Cheney?
Here.
Commissioner Casterline?
Here.
Commissioner Russo?
Here?
Commissioner Dupnick?
Here.
Judge Garza?
Here, we've got a full court. First item up, discuss updates to Aransas County Employee Handbook. Ms. Desiree.
Good morning.
Morning.
Can you hear me?
Now.
Okay. So last year I brought the updated handbook to the court for compliance and safety updates. Since then, I've met with the handbook and benefits committee, different departments and different employees, and I've incorporated those suggestions into the handbook as well. So I don't know if y'all wanted to go through each update one by one, or if you had specific questions already.
Let's go through the updates.
Okay.
And then we'll do specific questions?
Yeah.
Okay.
Okay, so for the first section, which is like the index, that's just updates on spelling and just different things that were added in. The next update would be on page 2 of 153, and that's at the top of the page.
And that says employee handbook acknowledgement? That's the
Yes.
page you're looking at? Okay.
Yes. Oh, we don't? Thank God. Okay. Can you hear me now? Okay,
Yep.
perfect. So on this one, it was just the suggestion from TAC to include, just letting people know that we can see what they're doing on their computers.
Right. We used to tell them that during
We
new
do
hire
still tell them.
orientation, but I thought putting this in there was very, very good.
Yes, we do still tell them, but it's better to have it in writing.
Yeah.
Okay, so the next big update is page 16 and 17, the equal employment opportunity. It's 1B-2.
So on 1B1, all you were doing was maybe changing the font? It didn't look like the wording was changed?
Correct.
Okay.
Yes. So I did discuss 1B2 updates with legal, and they said we should go with tax suggestion. There shouldn't be any changes to this, just so we're in compliance and we don't have any issues. And the next update is the next page, page 18, just adding in the Pregnant Workers Fairness Act, because we didn't have that previously. And then the next page,
Hold on. Hold
oh,
on, you're getting way ahead of me. I'm having a hard time following these numbers. Okay.
Just 1B4.
1B4, got it.
Yeah, it's easier to look at the sections than the page numbers, they're all messed up.
Okay.
okay. Then,
Now, in 50, what was 56 now? Or 1B 56? Categories for employment? Okay. Oh, I see that. Okay, okay.
okay, and then 1B6, the categories of employment, that again is just updating to be in compliance for the temporary employees. Are y'all ready to move forward? Okay. And then on page, section 1B9, position announcements, I removed that the county requires county job vacancies to be published in local newspapers. Sometimes they want to just promote from within, so,
Yeah, I have a problem with that. If it's an existing employee and it's a promotion up, I don't have a problem with it. But if it's a new employee and there's no experience here, I think it needs to be published to the public. I really do, because otherwise you can end up with, for the lack of a better term, an inbred employee base.
It is published to the public though, because we put it on our website, and a lot of people look at the website for employment. nowadays. I mean, newspaper is really, in some ways, obsolete when it comes to those classified ads.
And it is costly.
It is costly.
Well, that may be, but there's a lot of people out there that especially that don't have access to it. They don't have a computer at home, or they don't have a way to get to the library to look it up, or they don't know to do that, because they're not taught that. They know how to read the newspaper.
Well, I'm
So-
not getting rid of it completely. I'm just getting rid of that it's required. So, I mean, they can
Well,
still choose to
either-
do it.
Either it's required, then we do it, or we don't do it. I mean, you know, if you start volunteering information, that's a bad thing to get into. If you require the information and don't do it, that's bad. But if you require the information, there's no excuse whatsoever that they can't know about it other than word of mouth.
Well, another issue is the newspaper has a deadline of Thursday. So if I don't get it in by Thursday, it's not published, and it won't be published for another week.
What entry-level positions or what other positions do we have that 7 days makes a difference?
Some of them want to hire quickly, and they already have somebody in mind.
Again, my argument is, we're talking about employees. We're not talking about engineers. We're not talking about other people that are very specific where, you know, you may not have to publish for a doctor for the jail. That's up to the sheriff, okay, to look at that because it's very specific. You know, you don't have to publish for a road and bridge engineer or a CPA or something like that. You do all that through the thing or just word of mouth. But whenever it's for entry level or, you know, labor type thing, that people look at the newspaper and they don't always look at the website. We look at the website because we all have computers and we all are trained in that. But you take some of the kids right out of high school and everything, they don't have a clue where to look. So they know if they had anything going on, and they know that you do it in and out, that you always publish in the newspaper. And what does it cost us to publish in the newspaper with just a basic ad?
About $50 just for one day.
And how many
But
do
does
we?
the paper, they don't have a printed paper here. You still have to have something to get online to look at the paper. And I don't think, the
Well, we gotta-
pilot, they don't have a printed paper, do they anymore?
The Rockporter under the oath is still, that is the one that you find at the checkout stands and stuff. You know, it's the area, but it's still printed. And so I'm opposed to not publishing in the newspaper.
I will say the majority of the time we will publish in a newspaper. Like, I still do it, but whenever they're saying I want to hire within 2 or 3 days,
I
I'm
don't
not.
care what they say, because what we're dealing with here is the public's perception of how do you go to work for the county. You know, the public's perception right now is you gotta know somebody, you know, I mean, and that is not a valid perception. If you put labor and, you know, non-degreed or non-certified people, and you don't have to publish that, and you can go to a pool or whatever, that's one thing. But for probably 70% of the employees that we have, they look to something to see, postings at the courthouse or the newspaper. We don't have a newspaper that's Rockport, but we do have a newspaper that covers Rockport and their ads and everything else. And I'm not in favor of a closed system, because you get, if you have somebody that works in a particular department, whatever it is, and they're an okay employee or whatever, and they want their son or daughter to come to work, so they just keep it quiet and they just say, well, just put it in here, and nobody's gonna challenge you, then you never get improvement, or if you do, it's rare. Whenever we're looking for new employees, we're looking for new, good employees that take the time to look at finding the job. So anyway, that's my thought in that.
I don't think there's a problem. I don't have a problem with
Yeah.
it being there because, number one, you said they still have the option.
Yes.
And again, and most of the people are gonna be hiring are gonna probably be elected officials. There's a few appointed officials, but most of them are elected, and they should have the right to do what they wanna do also.
They could hire whoever they want. This
Yeah,
is just taking
that's
out that requirement.
Exactly.
Yes.
What if because this came up a few months ago when someone was promoted and the position wasn't posted, and I think I raised that question and we talked about it then. What if we, because I'm fine with taking this out, but in regards or in respect to what Commissioner Cheney says, what if we say we require county job vacancies be published in the local newspaper for those positions which will be competitively open, or something to that? And I know you say up here, there will be competitive consideration, but reiterating it there.
Well, I think we're taking it out too because the policy, it kind of,
The first sentence does say that.
I
but-
know,
Yes.
I know, but it's still,
The first sentence says, public announcement of position openings at the county for which there will be a competitive consideration are posted in public notice areas within the county simultaneously with notifications to the general public by publication in the newspaper. So it does say it'll be posted in a newspaper. We're just taking out that it's required.
well, then I'm fine with taking it out.
I'm okay with
Do
taking
we-
it out.
Okay.
And this is a
Okay.
workshop, we're not voting on this
Yes, correct.
consensus.
So if y'all have suggestions as well as something to add, we can. So the next update is 1B22, the introductory period. So TAC suggested we get rid of an introductory period because that's basically a contract of employment.
What page you say?
Page 26, so it'll be section 1B-22. And instead, I changed it to continue keeping that employees cannot get a merit raise until they've completed 180 days. I changed it from 150 to better
Yeah.
align with 6 months, which aligns with our vacation.
That's a good idea.
So you're changing it to 180 days?
Correct.
Okay. That's fine.
Okay.
And before you skip past there to the next section, looking at the gray with the red, and maybe it was just red because you were erasing things and they were being called out. I don't know how it appears in the actual handbook, and then I saw where you had gray with white. Can you just either lighten that gray so that we can tell it's a box, but,
I didn't actually change it. It's just whenever I was pressing like spaces throughout the document, it changed it like that. But
Okay.
in the actual document, it won't be like this.
Okay,
It'll
good.
be the original.
all right, thank you.
So that, the 1B22 is just going to say, all new employees must be employed for 180 days to be eligible for merit raise.
Correct.
Merit raises are already
See, that's what's-
budgeted and supposed to be supported by performance. Okay.
That's why
All
I
right.
just go with.
Okay.
Yes, sir.
And so the rest of that's going to go away.
It is.
I've been watching on this.
Oh, okay.
Okay, so the next section is 1C-7. And as you can see, the page number's wrong. It says page 22 of 153. So just go by section 1C-7. So I just added vaping into this.
Wait a minute, 1C? Let me get
Yes.
there.
It's also on our
1C-7, okay,
monitor,
I'm there.
so-
Yes, it's about smoking. I just added vaping into this.
Yeah, and Colin is also bringing up the correct section on the monitor too.
Yeah.
Because looking at these pages is confusing.
And then if you
But
scroll.
no, before you move past, were you
Last
going
one.
to do something else on that page, or were you going to skip to another section?
The same page.
Okay, go ahead.
So if you scroll down to 1C9, we had paid or unpaid listed in the handbook for nursing breaks. We need to choose one or the other. And since we've done paid in the past, I just suggested leaving it as paid and getting rid of the or unpaid.
I have a concern, though, with that second sentence following the paid. The nursing mother will be allowed whatever time is needed to express breast milk. I think we need to put a time constraint on that. If we can, I mean, visit with TAC.
Let me see.
But I mean,
do have
somebody could
notes.
be in there, well, it takes me an hour.
Let me see.
I mean, you can look into it and bring it back, but I would really like to have some kind of a parameter set on that break.
I do have notes on that. Let me just find them.
So if you had that instance, would the person be permitted to like leave the, say if they needed to go home or?
Well, I do have a room where employees can express their milk. It's next to a break room, so they can rinse out their items if needed,
Yeah.
and it's private.
But I guess I could see Commissioner Castellan's question, what about somebody in maybe animal care?
Or Road and Bridge.
Or Road and Bridge, different places like that in the future, you know, how does that address? You have a room here, but that doesn't suit their needs.
I know. Each location does need to have a designated area.
They probably need to have their own place provided. I mean, I don't know that we've ever had that here. 20 years, I don't remember.
I've had a couple, but the U.S. Department of Labor, I went to their site, so it says breaks should be anywhere from 5 to 20 minutes.
Okay,
So if we just go by that,
yes. Just not as long as needed.
so do you want to change the wording to per the U.S. Department of Labor standards?
And see what that is.
Okay.
Yeah.
Yeah, Lacey, when she bartended, she used to do it in the liquor closet at Applebee's. Sorry, Lacey.
Okay. All right, I'll move on to the next section. And that is, one second. 1C-22. Under Emergency Essential Phase 3, it was just missing the word hours. If you keep scrolling down. When I printed the PDF, it made a lot of
Yeah,
blank
there.
spaces.
Oh, I see.
See. Okay, and then the next section, 1C-25, social media. This was just a suggestion from TAC to include more social media.
Was that listed under the bullet points, or, oh, no, I
It's
see it.
the
I
very
see it.
top,
Okay.
yes.
Yeah, I see it, okay.
Okay.
First sentence, first paragraph, okay. Okay.
Alrighty. And then the next section is 1E-4, cell phone usage. We did not have anything about cell phone usage in the handbook, so I added this in there. As far as driving, also, that's included.
1E-4,
1E-4.
okay.
And I got this wording from TAC, from some of their examples. They had an extended version, but I thought this was sufficient.
Yeah, I think this is sufficient. I do have a question.
Yes.
So on 1E1, but going over to the final release or settlement, which is maybe on page 51. Okay, so under C, no other suitable position is available, blah, blah, employee is suitable. And then it jumps to the whole next page. And so when this is finally changed, will that come over and be
Yes,
in a
I don't-
coherent paragraph?
Yes, I don't know why all the spaces were
Okay.
indented or added when I printed.
How the track changes work,
Okay,
because all your commentary includes.
okay. So it's
Okay.
from commentary that's not actually printed on here.
All right, that's fine.
Thank you, Colin.
I can't wait to see this without all of the red and all of these big blank pages.
Yes. So the next section, I have so many yellow tabs. Let me get to the right one. It is for 1B-15, the sick leave pool.
Isn't it 2B?
Or did I say 1?
Yeah.
Yes, 2B-15.
Before we get there, could you scroll back to just 2A23? Which is, where I really want to get to is the page 77.
Promotions?
One, next page, Colin. Okay. Down a little bit more, stop. So, looking on there, upon promotion, an employee serves an introductory period of 150 days. And then under that, in lateral transfers, it talks about that 150-day introductory period. So since we changed that back in the other section, I thought maybe this could be reworded to say the 180-day, whatever you said.
Yes, I can change that.
Okay,
Thank you for catching that.
all right. Great. Then on to the sick leave pool.
Okay, so to be under maintain/renew membership, so it says 94 at the top of the page. Okay. So the reason for adding this update, we had an employee that donated to the sick leave pool for years. And then they happened to use the sick leave pool, and now that they used it, they don't have any more sick time, so they wouldn't be able to join it again this year. So this would allow them to be covered for 3 years since their last donation.
I wondered why this was in there.
Yeah, it's to cover those employees that, have donated for years, and now that they've used it, it's like we're punishing them, and they're not able to join it again.
About how many people would we currently have in that situation?
Just one.
And 3 years is, I think, generous, too generous. Did you check to see how other counties perhaps handled this?
Well, TAC actually suggested not even doing really a sick leave pool or allowing us to decide who gets the time. They said there's a lot of liability with it. So it's kind of an outdated thing, but I don't want to get rid of it completely because it seems to work for us. And currently we have, I don't know, I think 20,000 hours in the sick leave pool, maybe more.
That's 10 years,
So
10 years of employment, because 2,080 per year.
So that's how many people have donated.
Right, and some people who abuse it then can't qualify. I just think 3 years is too generous. I could see maybe 1 year. That would keep them current.
Well, the employee used it last fall, so then they weren't able to join this year, and since then they had follow-up appointments, so that cuts into their sick time.
Speaking as a cancer survivor, I still think 3 years is too generous.
What if we went with 2 instead?
Now, explain to me how that works. An employee gets cancer, okay? And first of all, when are they eligible for sick time? Do they have to be in the sick time pool
Yes.
in order to be eligible to use the sick time pool?
Correct.
Okay, so that's a decision that the employee makes, that the county, that becomes a benefit. If you want to pay into it, you can take back out of it, okay? All right, so if it's 3 years, diseases sometimes last a day, sometimes they last a long time. But if they've put into it for 3 years or 5 years or 7 years, whatever, they should be able to take out of it, as far as I'm concerned, whatever length of time they've put in it. Now, you know, I don't think if you've been in it for 13 days that you should get 4 years worth of sick time. That's not what I'm saying, or, you know, sick pay. But I have a problem with limiting it, because it doesn't cost us anything to start it. If they're the one doing the donation, all we gotta do is administer it. Is that correct?
Correct.
All right, so I think you ought to, I think 3 years maybe on the short side. Because you get cancer, or you get heart trouble or something like that, where you want to work, you need to work, but you can't work. I think if you've been putting into something for 17 or 18 years, and then probably, I don't know how long this policy's been around, a long time since it was here whenever I came, that's been 17 years ago. I don't think we should mess with it.
Well, we're not trying to limit how long they can use it. What we're saying is if you donated in 2025 and you had to use it this year and you run out of time, you're not able to donate again this year to join, your membership is good
Is
for
the
3
time-
years from 2025.
Is the time,
So you don't have to donate these next 3 years.
Because you don't have any time built up.
Correct. Correct. Because you don't have enough time built up to donate. So we're saying your membership is good, valid for 3 years, and then you need to start donating again to maintain your membership.
We have a lot of paid leave available. And the sick leave pool, when I was the HR director, had been abused, and we tried to make it less able to be abused, in that you would have to apply, which you currently do, and then instead of awarding the maximum number of hours, we would award a section of those hours. And then if they still needed more time, we'd go back, which I hope you still do, but I don't even want to get into that now. But to say it's no cost to the county is not correct. It is a cost to the county, because that employee has already used up all of their sick time, and they've used up other people's sick time. And to get into the sick leave pool, you can get in with as few as 8 hours. So, okay, a person donates for 3 years, 8 hours a year, they've given 24 hours. It's not like a bank account. I just
Well,
think 3 years is too generous.
Well, this employee had been with the county for about 20 years. So every year they donated, I mean, that's time that they could have kept, and maybe they wouldn't have had to even use the sick leave pool.
Perhaps
You know,
not.
We've got some department heads here, or I'm just an elected officials, I guess. If anybody has any input also from y'all, you know, you have the boots on the ground.
So, if you had an employee that was sick, they didn't have any, does staff, people who work here do have the ability, not even talking about the pool, could somebody say, okay, I wanna donate a week of my sick leave directly to this
We
person?
don't.
Unfortunately, we don't, and employees have asked me that. So would y'all be open to adding that in? That if they want to
I don't
freely
see
give their
why
sick
you
time to
couldn't.
somebody?
We had that at former employment, where people could, if people were running short, you could go in there and donate to that. And to me, that worked very well. You didn't really have a pool,
Right.
but you had, that way people had their time there accrued for themselves, but also if they needed to help somebody, they could. And
To me, I think that would be,
Yeah.
leave the pool like it is and add a separate thing that allows employees to donate to if donate or not to, if somebody works here, needs it, it's up to them, just like
Or-
donating to anything else.
Or somebody could donate on behalf, like
Yeah.
the person who used up the benefit and doesn't have any time to donate again, maybe his buddy could donate to that, or he or she, and still be in the pool.
Yeah.
That's
And I
true.
correct myself on that. Actually, they were
Yeah,
allowing
you
us to
know,
give
like
they were allowing us to give
different ways to do it.
vacation days, not sick pool days. But
Because I do see Commissioner, yes.
Come on.
Yes.
I was thinking, on the other side of this, your favorite, I like this, But you also gotta take consideration, there's people that are in the sick pool leave every year, and then maybe one year they use their sick time, and then they don't have enough time to get back in it again.
That's what we're talking
So-
about, Anna.
But we're talking about people that used it too, but you're saying you're using it, the sick pool leave, is what I was getting out of. But if you don't use the sick pool leave, and every year, like for instance, every year, I used to be in it every year. And then one year, I did have to use my own sick time, all of it. And then that next year, I couldn't get back in it, because I didn't have enough built up. So that's the same thing. So this one, you're saying, the only way you get the 3 years if you use that sick pool leave. But what about the people that didn't use the sick pool leave, but used their own sick time, but now don't have enough? See what, I mean, understand what it's the same thing.
You could only use the sick pool leave once you've exhausted your.
Right, but I'm just saying, we're saying the people that use the sick pool leave and then they don't have enough to get into it. But what about the people that are in the sick pool leave but use up their own time and then now they don't have enough to get back in it the next year?
That's what we're
So it's the
talking
same thing.
Yeah, that's what we're talking about.
The option I'm talking about is other employees could donate it to you.
I like that, and that's been
Up to
something
them,
I
no
have, like,
pressure.
that was one thing I brought up when I became an elected official. I lost 400 and some hours of sick time. I would have loved to have donated it to somebody, and that was told I could not. But I had built up that much sick time, and then there are people that didn't. I'm like, I'd gladly donate some of it
And-
to people that really could use it.
And you may, like you get to retirement or something and you have some sick time left or whatever, just donate it back to the pool to use
That
as.
too, or could we put it in the pool?
Yeah.
That's something that needs to be brought up as well.
Because, again, that's something they're paying for out of their pocket. And so if you don't use it, you lose it unless you let somebody else use it.
And I have had employees ask if they can donate when they retire, and I've had to tell
That's-
them no. So did y'all want to add that as well?
Well, I don't have a problem with limiting the amount that you donate over a period of time to 3 years. Because that way you don't build up such a massive amount of pool that, it just never goes to real fruition. But, maybe take it to 5 years or whatever, but at some particular point, you're in the pool, but you have met your full requirement to stay in the pool, and then you can drop out. And you stay in the pool for usage until you retire. And, that is a wonderful benefit.
I don't know, but I don't know if I would agree that when somebody retired, if they had the days,
Yeah.
because what's gonna happen?
That's
Are they
probably
gonna get-
right.
Are they gonna get paid for it when they retire?
No.
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 It's not, if you're putting your own money in, everything, you're buying a benefit, is what you're doing. And,
But the sick leave is made available to cover people while they are here working. I mean, what you're suggesting would be a major addition of financial liability for the county. We
Why?
would just have a burgeoning sick leave pool that was available to be used for almost anything. We have county employees who tremendously abuse their sick leave. And I know the new treasurer is here, and this will be the first year, but the former treasurer used to send out those reports every year to the elected officials and the department heads to let them know what the employees in their department had in the way of vacation and sick leave. And we have people who've been here for 20 years.
You sure that's
That have
not
not had-
violation?
Well, we get it every week, just the number of hours that are available to employees. I mean, every payroll week we get it.
Okay,
But that, you did bring up a point, there's a financial tie to that also. 'cause
Yes.
Those,
Yeah, that's what my thought on, when somebody retires, I don't know that you should be able to donate what's left. I think people that are working, if they want to donate to an individual outside the pool,
And then Rebecca had a point, she wanted me to say, so to donate to the sick leave pool, you have to have 88 hours essentially, because you have to have 80 hours after you donate, and it's a minimum of 8 hours that you're donating each year.
Oh, and that's why.
So that's why it's hard to accumulate that. I mean, yes, you could accumulate it over a year, but if you just use the sick leave pool and then you have follow-up appointments the following year, it's going to take you time to be able to join it again.
Jackie, did you have a comment? Did you make a comment?
Well, what I was just saying was that the pool and any of the unused sick leave is a liability on our books. I mean, it shows as it's something that we would have to pay, so it shows up as a liability. I mean, it's not dollars, but it actually does show up on our financials.
Turns into dollars eventually.
Yes, it does.
Yeah.
And I will say, we've only used it once since I've been here. Only one employee's used it, and I've been here almost 3 years. So it's not being abused currently.
What about changing it to, they retain their membership for a period of time that's limited to the amount of time they put into the sick pool? So if they,
Have-
Like a clause, maybe using
Up to a
what they
certain
have
limit.
donated prior to years.
Has the benefits committee spoke on this? Is this something that they're?
We have not.
Are
No.
you saying like if someone had 10 years, they could donate 8 hours every year, so they would have 80 hours in that pool?
right, that would let them stay in to be in it for up to 80 hours and allow them to accrue at least another year.
So let's
If they
take it
didn't
back to the
happen to use
benefits
it.
committee. It
Okay.
needs some work.
Okay.
And also, I had a question. On the membership of the sick pool committee, how often well, you said you've only had one request in the 3 years you've been here. So has that committee been changed much?
Oh, for the sick pool?
Yes.
Yes. So where's the section on how to pick them?
I think it's on page 96. Under sick leave pool application, down under pool administrator responsibilities, and then the committee is under that.
Yeah, so we did do the random drawing for employees when we had to do it, because it says 2 employees whose name will be drawn at random, and 2 department heads that are drawn at random. So we did do that, and then we did include the auditor, the treasurer, human resources.
Okay.
Yes, like we followed that.
All right, good. Thank you.
Okay. The next section, 2B-16, I was just adding Juneteenth into the list of holidays.
And then some other language.
Yes. And then on page 99, which, yes. So we've had issues with employees leaving before an early release for a holiday. And then there's been questions about whether they should be paid or not. What we have done is whatever sick or vacation time they're supposed to use, we've made them use it. So this is just getting it in writing because we've had some pushback on it.
Could we go back to the holidays? Is that okay with you, Judge?
Yeah.
I just had a question about Juneteenth. I don't have anything against Juneteenth, but we,
Aren't we required to do federal holidays then?
that is a requirement, that's okay.
With the grants.
Yes.
Okay, with the grants, that is, okay. That's all I was wondering about.
Yeah, that's why it was added.
Okay.
Do you have any questions on the next section, the added wording? Okay, so the next section, 2B-21.
So can I ask a question about the previous days? So if somebody's gonna take a vacation and a holiday was in there, why would you even count the holiday as, since they were gonna be off that day anyway?
Well, no, we're talking about early release, so like when the judge lets us go at 3 p.m.
Yeah.
So people that already had scheduled vacation or sick time, they're trying to say, oh, those last 2 hours should not be used for vacation or sick. Okay, so now the next section, 2B-21, bereavement. So with this as well, there's been issues. We have discretionary funeral leave, which allows an employee to have 8 hours for use of a friend or a relative. And then below that, relative was defined as an employee's family member who's not an immediate family member. We want to remove that. Yes, employees have 24 hours for immediate family members, but the 8 hours discretionary, elected officials and other department heads have asked to allow their employees to use those extra 8 hours for immediate family members if needed, just because we don't know what their grieving process is, so I don't think it's right to limit those additional 8 hours.
I don't know.
So then essentially we're giving employees 32 hours to use for
I,
whatever they
I
want.
have had an employee that his same grandfather died 3 times, but he wasn't smart enough to remember which grandfather funeral he went to.
Yeah.
Yeah,
So it's 32 for immediate family members essentially, and then 8 hours for friends.
So actually, you've gone over to page 104.
Yes.
So that's 40 hours of bereavement leave?
32.
32. Oh, okay. Tana, what did you just say?
I was just asking for clarification if we have 32 to use however that may be, or it is 32, she said, and 32 for immediate and 8 only for non-immediate.
Yes, so everything stays the same, like it says immediate family members are 24 hours. It's just the discretionary, the 8 hours, instead of defining relative as non-immediate,
Okay.
it's just a relative.
I mean, it could be like a best friend.
Well, friends included in the discretionary,
Oh, okay.
yes.
Yeah.
What if it's like a husband and wife killed in a car wreck? You just get one 32-hour, right?
Mhm.
Or would you get 64 hours?
Just
For the
32. It's once a year, 32 hours.
Okay.
on that, number 3 there, it says 8 hours each calendar year of paid funeral leave to attend the funeral of a relative. So if they have more than one funeral during the year, do they get, that's the limit, that one time?
Well, this is just the discretionary for number 3. So they already get the 24 hours they can use throughout the year. The discretionary is just an additional 8.
That's,
Okay.
okay.
I mean, it could be like a coworker.
Mhm.
Good
Yeah,
question.
that's,
I didn't even think of that.
And the word may be allowed basically means that they don't have to do it if they don't want to do it. They don't
Sure.
have to approve it. The department, it gives the department head the ability to decide whether or not to give the an extra 8 hours, because it says it may.
Correct.
Okay, good.
Okay, in the next section, this was just updating the quarantine leave. I had worked on this since 2024 with Amanda Oster and Michael Brooks, so this was just the final version.
Who's Michael Brooks?
Chief Deputy?
The
Oh,
chief
okay.
deputy, yes.
Where are we now?
2B-21, just
Okay.
right below. So it has been reviewed by legal, so.
Probably this will be straightened out. But under Roman numeral 3, paid quarantine leave for public safety officers. Number 1 is quarantine or isolate, or order to quarantine. And then number 2, which is paid during quarantine leave, is in that same section.
Yes, it'll be corrected.
Okay. And then, so moving over to the next page on number 6, off-duty exposure. Who gets to determine the source of the exposure, or how is that determined?
I'm not sure, but Tana said the elected official.
An elected official gets to determine?
Well, I would think like if they're on vacation and they
Yeah.
come back with COVID, like it'd
They
be
went on a
something like that.
They went on a cruise, came back, and they're sick, and they can't come to work.
Yeah.
And then, to be eligible for quarantine leave, number C, have a positive or current COVID-19 test clearly identifying blah, blah, blah. Does that really need to still be in there? Have you visited with TAC?
I've not visited with TAC on this, but I did go through it with, like I said, Amanda Oster. We had worked on it since 2024. So we were just trying to update the handbook to be in compliance.
So maybe you would just have something from your doctor. I mean, like now they.
Medically.
Pretty much every time they test you for COVID and flu and everything when you go in there.
Yeah. You could have rubella, or you could have,
You know, maybe if you don't want to just put COVID, put multiple things or some other terminology.
medically required or requested quarantine. Because you can't just quarantine yourself. You gotta have a medical physician. I would say, medically prescribed or, and because we're not gonna go against what the doctor says for us to do anyway.
Yes. I think the issue was that some employees were just saying they had COVID so they could just be off. So this is just trying to hold them accountable and.
In consideration of HEPA laws, do they present that to the supervisor or to HR?
HR.
Okay.
Because it says below, one of these items must be turned into HR within 24 hours of returning.
Okay.
I would change C to say, upon a written statement from physician,
Doctor's note.
documentation from a medically authorized person, then they could claim quarantine, or they could require quarantine. Because if the doctor comes back and says, this guy's got rubella, or he's got German measles, or something else and needs to be quarantined, then, we're gonna be hard pressed not to pay them for being off for quarantine because you're following the medical physician. And take COVID out, and then that covers everything that the doctor would be willing to put their license on the line to say need to be quarantined.
But we're required to pay quarantine for COVID-19, not for
We're
other sicknesses.
But we're required that anyway. But if
Mm-hmm.
you got somebody that has some sort of communicable disease that's readily communicable, you don't want them here anyway.
Well, and that's in B, so maybe C is redundant.
Yeah.
Yeah, so B basically says the same thing, except it doesn't spell out COVID.
Well, it says B or C that they could present, not that they have to do both.
Yeah, just
Right, so-
one or the other is all it takes.
Right, okay. I can do that.
But why couldn't we just scrap C and just let it stand as B and not have the or in there?
Are we required to do the COVID? Is that what you said a while ago?
Mm-hmm.
So that language needs to be in there, specifically, not just COVID, but to make sure COVID is concluded.
Well, I think also, for your point for not having C, I think that they test them at the location sometimes instead of just sending them to the doctor. Because like we do have medical staff at the jail, so they could just test them and like then we have that positive test result for C.
Well, if you have COVID to a certain degree, you're required to go to isolation, right?
Mm-hmm.
Okay. I like C, I like B. I understand C if it's required, but I like B as well because there's a lot of other diseases out there. Legionnaire's disease and all kinds of stuff out there that you really don't need to be spreading.
Mm-hmm.
Okay.
So what about A? They are required to quarantine or isolate by their supervisor. How does the supervisor have the authority to
Yeah,
make
I
that
wouldn't agree
decision?
with that. Yeah, I think it has to be by,
Maybe by your doctor.
by a medical person, physician or whatever.
So do you just want to get rid of A?
I don't know that we even need A.
Yeah, I don't know that we need A because who's saying the supervisor? I mean, maybe they know, but in the others, we're asking for a more official notice.
And-
It
and by
mentioned
having
it, didn't it
official
mention it
notice,
somewhere's in there about that though, or somewhere else about the supervisor? If they think they may have been exposed, the supervisor, say a deputy or maybe one of the clerks dealt with somebody and that person turned out, a member of the public, turns out they had some, communicable disease, so you knew they had hand-to-hand contact or firsthand, so the supervisor has a right to say, why don't you
That's true.
isolate?
Yes.
Or at the jail. like-
Yeah, at the
Yes.
jail, yeah, exactly.
Yeah,
So
number
we should
6.
keep A then, because if they say everybody in that pod got sick, then you need to quarantine for 3 days to make sure you're not carrying it.
Yeah.
Yeah, but I don't know that a supervisor is trained well
Right.
enough to know the different types of diseases.
Well, if the supervisor finds out somebody
Saying if
who we're
Tested
dealing with
positive.
had Positive, you
Yeah,
have
if they want to do mass
responsibility.
quarantine, yeah.
Yeah.
Yeah, and it is, I just went back, based on what Commissioner Jumnick said, on the previous page under number 6, it says paid quarantine leave means leave ordered by employee supervisor or health authority due to a possible or known exposure to communicable disease while on duty.
So we'll keep A then.
I guess.
Okay.
Don't like it, but yeah. Okay.
Okay. So no changes then to anything. We're just leaving it. Okay, the next change, it's just a minor change on page, it says 115, trying to find the section code, 2B-23. It's just the words were combined, this includes, so I just put a space between them. Same thing for page 73, it's not 73, but on that same section.
Number 4,
It's number 4, it says position upon return. Through there, past all that.
Okay, where are we now?
There.
Position?
See, it's not really page 73, because,
It's on the screen, it just
yes.
shows
I
a
see it.
break between more and than.
And then on the very next page, 2B-24. So for Family Medical Leave Act, employees, I got rid of continuously employed because they don't have to actually be continuously employed. They just have to have worked 12 months in the past 7 years to qualify.
Did
So
the
that's just-
federal government change that language? Oh, jeez.
Okay. And then the final thing,
Wait a minute, don't leave that yet. Go back, I want to read that again. So what that's saying is, if you've worked for the county within the last 7 years, why is that, if you to be eligible for a family or medical leave, you should be working for the county at the time, right?
well, yes, you'll be working for the county at the time,
But it
but some
doesn't
people
say
have a
that.
break in service for like maybe 6 months and then they come back.
It just makes it much more generous on who qualifies. Thanks to the federal government's Department of Labor, I suppose.
So if we have somebody that's been working 6 years and they have someone killed in an accident or cancer or whatever, they're not eligible for family leave. You gotta work 7 years to be
No.
eligible. That's what it says.
You just have to work 12 months within the last 7 years.
So,
So like we have an
Over a 7-year
employee-
period, you
I
could have
don't
worked
understand that.
12 months.
Yes.
Yeah, and you still will qualify, whereas
Yeah.
before, you had to work at least 1,250 hours in the previous 12 months, and now it's been extended to
Yeah.
84 months. If you've worked in the last 84 months, a total of 12, and worked at least 1,250 hours.
That's still there. The 1,250 hours is still there. So for example, a jailer worked for us last year and they left for 3 months and then they came back. They're going to make up those missed hours
Right.
quickly.
Right.
So the 1,250 is still there.
Yeah.
They still have to qualify by that.
Yeah.
It just tremendously expands the people who qualify for this.
Okay, so the next section, 2B-31, out-of-county travel. We wanted to update our travel expenses for breakfast, lunch, and dinner for employees, and rather than putting a dollar amount, we wanted to just say equal to the U.S. General Services Administration rate set each fiscal year. So that way we're not having to update the handbook every single year or every single time they change it.
Just like mileage is based on IRS.
Correct.
What do those figures look like?
So breakfast is now $16, lunch is $19, and dinner's $28.
So they were very generous on breakfast and everything else was pretty small. Have a big breakfast. I think that's a good idea, though, to tie it to that standard,
Yes.
Yeah.
because I've been with the county since 2012 with a break, and those rates hadn't changed in all of those years.
Do you have any additional questions on any sections I didn't go over or any changes you want to suggest?
We went over all of mine.
Okay. And then I'll meet with the benefits committee about the sick leave pool.
Okay. That was the only thing that we really have pressing, right? Sick leave?
I had a few other changes.
Okay.
I had a few other notes. So,
So, the meal, are we going to bring that back to court for an official approval for an effective date?
Well, once we approve this handbook, then it's part of the order.
Just making sure when people are submitting their meals, when we change the rate.
And so at each budget year, we would find out where it was whenever we budgeted, and then that would take away that issue as a baseline. Yeah, okay, that'll work.
All right, any other questions?
Do you want, move to adjourn?
Yep.
Okay. Move to adjourn.
Second?
Commissioner Cheney?
Aye.
Commissioner Casterline?
Aye.
Commissioner Russo?
Aye.
Commissioner Dupnick?
Aye.
Judge Garza?
All right, thank y'all. Appreciate it. Thank you, Desiree.
Yeah, thank you.
A lot of work.
Bloody Mary with breakfast could cost as much as $9.